Victory over heart disease, creating life-lasting results. Hi, my name is David Martens, Clinical Manager of the Cardiac Rehabilitation Program. I'm very excited about this presentation. It will help you achieve outstanding results over the next 12 weeks and, better yet, continue to improve your health for many years. The purpose of this talk is to give you a foundation so that you can get the most out of our education and exercise programs and create your own personal plan to stop the progression of your heart disease. That's why you're in our program, to create the right plan to stop and possibly reverse heart disease. After this talk, you'll have a better understanding of the following areas. Before true learning can occur, you need to understand your own heart problem and what you can change to give you the best results. How important it is to identify your personal values and how they relate to your health and fitness plan. The benefit of having specific plans to improve your diet, eating habits, and exercise. How you can create confidence and the importance of building confidence. The need and value of family, friend support to help you be successful at exercise and eating healthy. The better you understand your heart condition, the more likely you will understand the need for change and will change. Many heart procedures such as bypass surgery and stent placement fix partial or complete blockages, but do not stop heart disease. That's why many of you are in cardiac rehab, to stop future plaque from forming in other areas of your heart, brain, lungs, and legs. You're not done. Heart disease can progress. Unfortunately, open heart surgery and stent placements have no impact on stopping coronary artery disease. True, the procedure fixed a serious problem, but unless you control your risk factors, your coronary artery disease can continue to progress and new blockages may appear. Understanding how heart disease can progress in your body can make you more determined and open to making heart healthy changes. We review this during your orientation. Participating in our high-quality cardiac rehabilitation program offers you the best chance at stopping and controlling your disease versus doing it alone. Studies on human behavior show we hate to lose twice as much versus gaining something of value. Bottom line, people do not like losing things such as health, money, independence. Fear of losing your health can be very motivating. Your values can guide your behavior. Since your cardiac event, you may have changed your values and their level of importance. In cardiac rehab, we will ask you to select from a list of values, your top 10. Then number them, 1 to 10, with 1 being your most important value. To understand how following values can help you, let's review some examples. Let's look at the value of being financially stable. By improving your health in cardiac rehab, you will be able to spend less money on health care and more money to spend in other areas. If you are working, you will be able to continue working. Many people put a high importance on the value of being independent. They enjoy the ability to do things on their own, such as driving, travel, continuing their hobbies, visiting friends, and much more. A person that comes to cardiac rehab 3 times a week, home exercise 3 times a week, eats healthy, has lost 10 pounds, has a much better chance at being there for their family and friends versus a person that is not improving their health. Without good health, it would be tough to follow the values of adventure, discovery, travel, and fun. Being told to exercise and eat healthy works, but may not last very long. Feeling guilty so you exercise and eat right works, but again, may not last long. If you can personally see how exercise and eating healthy is going to help you follow and enjoy your values, you switch from I have to exercise and eat healthy to I want to exercise and eat healthy. Here's a list of values picked from participants of cardiac rehab. Planning is very important in human behavior. When we fail to plan, we tend to react badly when hungry or tired. Without a plan for these times, people tend to make unhealthy mistakes with their food choices and exercise. In our program, we will have you make an exercise schedule for both cardiac rehabilitation and home exercise. When you exercise most days of the week, exercise becomes part of your daily routine, like brushing your teeth. Your body will start to signal you to exercise. Let's see how a plan can help you exercise. Pack your gym bag the night before you exercise. Consider having an emergency gym bag in your car. That eliminates I forgot to bring my exercise clothes, a very common reason for missing a workout before or after work. Your backup plan, remind yourself if you miss your cardiac rehab workout on Monday, Wednesday, or Friday, you can make it up on Tuesday or Thursday in the morning. Before you food shop, plan your menu for the week. Your foods should follow the Mediterranean or DASH diet. The benefit of following one of the two diets is eating much more vegetables and fruit, less processed food, and 3 ounces of meat per day. This helps you lose weight, lower your blood pressure, blood sugar, and improve your cholesterol numbers. Eating something before you food shop will also help you from buying processed foods. Plan your breakfast and lunch the day before to limit mistakes. Following your menu will work much better if you're organized. Some find using a crock pot to be helpful to organize the night before. Then the next day, take it out. When you get home, dinner is done. 80% of our participants could benefit from losing weight. Large portions, refilling your plate, and poor snacking behaviors can make it almost impossible to lose weight. Before you eat, think about your portion size, eat slowly to avoid overeating, and stick with your plan. Many people do not eat healthy snacks. A lot of snacking is unconscious. You are signaled to eat. It could be an emotion, it could be visual, such as watching TV, or a thought. Bottom line, many of us do not need to snack so much, and many of us need to stop eating processed snacks. If you plan healthy snacks and change this behavior, you're eliminating a lot of calories. Try to stop eating chips, crackers, pretzels, and replace with fresh vegetables or fruit. Our dietitians can give you many ways to snack healthy. If you have a plan for overcoming your barriers that prevent you from exercising, you will have much better results. For example, if you feel too tired to exercise and you do not have a plan, you will probably not exercise. Here's one possible plan. If I feel tired, I will try to exercise for at least 5 minutes. If I'm still tired, I will stop. If I'm feeling better, I will continue to exercise. Another example. Exercise is boring. I just do not feel like exercising today. A plan may help. For example, if I find my exercise program too boring, I'm going to talk to the cardiac rehab staff for advice on how to make my program more exciting. In order for exercise to work, it has to be done every week. Many people are seasonal with exercise. They do a great job when the weather is nice, but are not doing enough 3 to 6 months each year. A plan could help. If it is too cold or hot, I will exercise in my home, go to the gym, or to a large store and walk. As you are exercising in our cardiac rehab program, I want you to notice if you like exercising in a gym a lot more versus exercising on your own. If this is true, talk to our cardiac rehab staff and start planning for your next gym. We have a fantastic follow-up cardiac rehab program at the Health and Wellness Center in Warrenton, Pennsylvania. Sometimes things do not go as planned. For example, some people need to lose weight and are not getting results. You will need to create or change your plan. One idea is to log what you eat as you eat, and then make an appointment with a dietitian to form a new plan. Ask our staff why the word moderation may hurt your results. It's hard to follow a diet that lacks taste or variety. Try buying a heart-healthy cookbook as well as calling our dietitians on how to add more variety and flavor to your menus. Support is a critical part of becoming heart healthy. I personally struggled in my 40s and 50s trying to lose weight. I had the knowledge, I knew what to do, and yet my weight was going down a few pounds and then up a few pounds. I changed my strategy and started to ask my family for support. I make a plan each day and then ask my family for help. The result, I lost more weight than I thought was possible. Explain to your family and friends what you need support on to improve your heart health. There will be times that you may not like their support, but remember, they are trying to help. You need their support if you're going to beat heart disease. Some of you may need support to attend cardiac rehab 3 times a week. Others may need support to do home exercise 3 times a week. We recommend exercising 6 times a week because the minimum requirement is 5 times a week. Exercising with someone is much more fun than doing it by yourself. That's why for me, I'm a fan of going to the gym, or you can find someone to walk and exercise with. Most people do not like exercising at hard levels. Please let our cardiac rehab team know if your program is too hard. Exercise should not make your pain worse. The timing of support is critical. As the day progresses to dinner time and later, our willpower drops, and we are more likely to overeat, eat unhealthy foods. Each day, make a plan. I'm going to stop eating at, for example, I plan to stop eating at 7 p.m. and then I'll ask my family to help me not snack after 7 p.m. When I did this, I was amazed how many times they helped me keep my plan. You need 7 to 9 hours of sleep to get the best results to improve your fitness, weight loss, blood pressure, and diet. Not getting enough sleep will decrease your willpower, affect your ability to exercise, and may cause weight gain. Dinner is just 20 minutes from being done, but you're starved. If you snack, you'll consume too many calories for the day. It will hurt your weight loss goal. Ask for support not to eat until dinner is served. Or if you really cannot wait, follow your healthy snack plan. It's one of your favorite meals for the week. You know there's a good chance of overeating. Plan on how much you're going to eat. Ask for support to help prevent you from overeating. You may also eat a salad before to prevent overeating. What's your worst food enemy that causes you to gain weight? Ask your family or friends for support. You may need to throw some food out, change how you shop, or change your menu. Support can make a huge difference. Do you see yourself as a success? You've lost 5 pounds, faithfully come to cardiac rehab 3 times a week for 1 month, or followed your diet 6 out of 7 days per week. These are fantastic success stories. You should see yourself as a success. You should feel good about yourself. You're getting healthy. Feeling successful will help you continue to create more success stories. Fitness trackers can also support you to create success. For example, your steps per day increased from a range of 3,000 to 5,000 steps to 8,000 to 11,000 steps per day. That's huge, and that improvement should make you feel proud. There's power in noticing your improvements. For example, you improved your diet, lost weight, and are exercising at least 5 times a week. You have noticed more energy, walking faster, climb stairs and hills, better tolerance. Cardiac rehab staff may also tell you you have better blood pressures and cholesterol numbers. You should also notice that you feel better mentally. The more you can see these improvements, the more likely you will continue heart-healthy lifestyle. Watching other cardiac rehab patients succeed in our program will also change your view of your future success. You'll believe much more that you're going to achieve the same result or better. It's very important to stay positive. Staying positive will help you get better results. It's important for you to believe in yourself and believe you will be successful. Another way to keep your motivation is to set up a reward. One idea, collect your loose change. At the end of the month, if you lose weight and exercise 5 times a week, use the money to buy something fun or do something fun. If you do not meet your goals, give the money to family, friend, or donate it. You can also use a penalty to motivate you. One example, if you do not meet your monthly goals, give control over the TV to another family member until the next month. If you have not yet filled out your value and goal sheet, please take one from the cardiac rehab hallway. Please fill out and return it to us. We'll photocopy and return it. Then please review your values, strategies, and goals once a week. You now have the tools to create better short-term success and life-lasting results. Every 30 days, we will be working with you on your values, strategies, results, and goals. We know you're going to be very successful. These techniques work. My story, I have a family history of stroke and heart disease. The value of family is very important to me. I want to protect and help my family. The best way I can be there for my family is to eat healthy and exercise. In my 40s and 50s, I struggled with losing 15 to 20 pounds. But once I asked my family for support on no desserts, the weight came off. So the value of family and asking for support worked for me. I know you will have success by thinking of your values and the use of some of the strategies given in this presentation. Our team looks forward to supporting your new heart-healthy vision.